Right, I'm going to move on. So I'm going to spend a few moments taking you through what the charity does and what we've been doing, because I'm sure a lot of you will have questions going, it's all very well, does it take them all year to set this up? No, we do a lot behind the scenes as well. So I'm going to take you through some of those things. So first of all, I want to share some information with you. So this is our Facebook membership growth. And you can see there's been a steady increase all the way through for the last 5 years. And in fact, last week we hit 600 members, which is great. Hang on a sec. There's seats down there. So that is great news. But we need to find more. There are more of us around there. And we need to make sure that all ALK positive patients in the UK are aware of the charity. They might not want to be a Facebook member, and that's perfectly fine. But what we don't want is anybody missing out on an opportunity to come to the conference or any of the regional meetups, or take advantage of any of our resources on the website. So that's the important message is there are resources that can help others. You don't have to be a Facebook fan, okay? So our vision, and for those of you that have been with us for a few years will know this, but for any newbies, it really is, our vision is that everyone will be diagnosed as early as possible and to receive the best possible care and to live our best lives, which I think most of you in the room seem to be doing and were last night, and to live as long as possible. So the way we do that is, first of all, we need to support one another. And so we have the Facebook group, as I've already mentioned, but we have the patient conference, and this is now here to stay. Now we've done our second. We can't break a habit now, can you? So look forward to news of next year's conference. And we have our regional get-togethers. And if you haven't been to one yet, I really would encourage you to go. The feedback from them is fantastic. We have our online coffee mornings, and in fact, the next one is next Wednesday, because it's the last Wednesday of every month. So, and everyone is welcome to join. We don't talk all things ALK. We talk weird and wonderful and everything that you can think of. It's a proper coffee morning. We have our online fitness classes, a bit more later on that. We've got our life coach, and Jane is with us today. So she's over there. If you haven't met her, by all means, go make yourself known to her. And we also provide one-to-one support by email, telephone and text. The other thing, the most important thing I think we can do for ourselves is to empower ourselves. We can't expect every lung cancer consultant in the UK to be an ALK expert, but we can be, and therefore we can tell them what is best care, and this is what the centres of excellence are doing, this is what the ALK experts are doing, and I would like you to treat me in the same way. Now, in order to do that, we need to upskill ourselves and to educate ourselves, which is why, as a charity, we've provided booklets, leaflets, guidelines, videos, and they're all on our website. So everything you need to access, you can access via the website. And then if you want hard copies of any of the resources, there is a very simple email button on the website. We couldn't make it much easier. All you need to do is email us, and we will email you hard copies as well. So there's no need for us to not know anything about our own care, okay? So these are some of the publications you can see, and some of these have been published in peer-reviewed journals as well. So we're getting the name out there and being recognised as well in the UK. You should have received a copy of one of these in your delegate bags Friday. So these are the most recent publications that we've had done. The one came about, actually, the do not resuscitate decision came about as actually a problem that one of our members was having. And so the charity was able to support them with our medical and scientific panel, putting together the guidance in the UK, and they were able to use that with their oncologist. And again, we've had instances where patients are having problems with their hospitals and getting the right level of care. And so we now have the small booklet on how to complain to the NHS. So the last thing that we do is around advocacy. And together we hold a wealth of real-world data on our treatments and side effects and all different aspects of our health. We know how people are diagnosed, the pathway they go to get their diagnosis, and sometimes it's shorter and sometimes it's longer than we would like, and the treatments and also the effects of those treatments. And we know in between us the effect that they have in real life, not in a clinical trial setting, which is different. So we're able to provide that information. So we know that with previous surveys that we've done, that not everybody across the UK gets the best care possible. And our vision is that one day we all will. But there are differences in time to diagnosis, in frequency of scans, availability of MRI scans for brain scans, whether patients have a named nurse or not. Do you all know your named nurse? If not, can I ask you to go back when your next appointment and ask who is your named nurse? Because you should all have one. And also bone strengthening. If you've got bone mets, you should be on bone strengthening treatments, according to the ALK experts. So again, it's something to take back and speak to your oncologist about. And blood thinners. If any of us have had a DVT, and I have, then if you talk to the experts, they'll tell you should stay on blood thinners for the rest of your life. So you need to have that conversation again if you're in that situation and you're not on them. And side effects and counselling. It's very sporadic around the country, the availability of counselling for patients. So every few years we do surveys, and this gives us the data that we can then use in our arguments to healthcare professionals that they need to up their game in some instances. So the good news is you've got two coming your way. One is a very short one, so and that will come quite quickly after the conference. And what we want to hear about that, and the reason we're asking for this survey, is to understand what you want from the charity. So how do you feel about what we've delivered so far for the last 5 years, and what do you want to see in the next 5 years? Okay, so that's a very short survey, but then we're going to reissue our very long one, and I'm not going to apologise for it. It is quite long. You need to get a glass of wine or a cup of tea or something by the side of you, and then go, right, this is it. I'm in a darkened room. I'm going to do this. But we need that information because that's really valuable information, and it allows us to engage with healthcare professionals and explain what the situation is for ALK patients across the UK. And that's the way that we can advocate on your behalf. We need that data. It's all anonymised, so we're not asking anyone for their names. But if I please can get a concerted agreement today that you will complete that large questionnaire, then I would really appreciate that. That's my ask of you guys. So in terms of advocacy, we've got relationships with all these organisations and also with these. And we spend a lot of our time networking and making sure that non-smoking lung cancer is on the agenda. So, and it's important that it is. So, so we will continue to advocate in that way. So, a blank slide there. So, what I thought some of you might be interested in is looking at our income stream, because obviously you can't function without money, unfortunately. And so this is what our income looked like for 2022. And you can see a massive thank you from me for all the fundraising that you guys have done. Not me, that's you guys. And I can't thank you enough, because we really wouldn't exist without it. So that is a phenomenal amount that between you have raised. And you can see we do apply for grants from pharma companies. And also there you can see the other areas of income. And this is our expenditure. So our conference is the biggest expenditure, followed by, printing and publicity to raise awareness of the ALK Positive charity and the work it does, and also the publications to make sure that, you know, we're arming you with the right resources to go out there and ensure that you're getting the best care. So, as great as the fundraising was, it always comes with a but. And we need a more sustainable financial platform. And in order to do that, what we launched last year was our Many More campaign. And a lot of charities have them, where Macmillan ask you to give a monthly donation, so do Roy Castle, so do all the other charities. We're no different. We're asking if anybody wants to, you can sign up to our Many More campaign, where you can make regular donations. Anything from £1 upwards, we're not proud, and anything is gratefully received, and we do spend all the money outwardly and wisely. Okay. So this is what we've been up to this year. So that's kind of a little bit of last year. But these are some of the activities, and you can see we haven't really been, static. So I'm going to come on to some of these in a bit more detail. So I know I've rushed through them, but there are some special mentions I want to give. And the first one is I would like to give a special mention out to these guys. So our DVLA panel, and I don't know whether you want to stand up and take the recognition. It would be nice if you did. Duncan. Where's Ian got? Duncan was taking the recognition on all of them. So Paul wasn't able to come, but I thought Ian was here. So these guys are working tirelessly to try and improve the situation with driving and brain mets in the UK. It's not an easy task. The DVLA do not make it easy to engage with. So, but they're on the case, and they haven't lost their focus, which is great. We have our medical and scientific panel, and they're the team that have developed the Do Not Resuscitate booklet, and they also check over all our other resources to make sure that they are factually correct and medically correct. So they do a great job behind the scenes. And then we have our events manager, Carol, who isn't here today because she went off to actually enjoy her birthday that was on Friday. Poor woman. So, but she's done a great job in organising the conference and pulling all this together. I'd like to say thank you to our regional ambassadors. So we have, this should have been updated last night because actually we've had a number of people volunteer to be regional ambassadors since the conference started, which is great. But they've done a phenomenal job and they'll continue to do so. So if you didn't get the message from Angela yesterday, the next meeting is the 2nd of December and everyone is invited to their nearest regional meetup. Where we will celebrate 5 years of the charity, and also it's close to Christmas. So, yeah, hope to see lots of photographs with lots of people there. Again, another success this year has been our Living with ALK life coach. So we started this the previous year and as a one-off, and made the decision amongst the board that we would invest in this resource. And so Jane is our life coach, and as I say, she's over there, and Jane delivers 6-week workshops on how to live well with ALK positive lung cancer. We can't do anything about our diagnosis, but we can affect our mental attitude. And so she runs 3 of these workshops a year. So she's just started one now. So if you missed last week's, it's not too late to actually start. They're on a Wednesday evening, 6:30. God, I got it. But I can give you details, or Jane can, if you wish to join. So, and therefore, not just for the ALK patient, but also for their supporter and their partner, okay? And also Jane will offer one-to-one sessions as well. And they're all funded by the charity. So, so it's a great resource if you are having a bit of a struggle with getting over one of those bumps in the road, it's worth speaking to Jane. And this year we made a clear commitment to improve our outward communication on what we do to try and raise awareness amongst all healthcare professionals and the general public, for them to see, who we are and what we do. And so we employed a social media manager, Laura, and she's been doing a phenomenal job. She launched our TikTok channel. Who does TikTok in here? There's got to be a few. I do. You are missing some fantastic. They're not videos. I think they're reels. I'm not sure. I'm not down with the lingo, but you are missing some fantastic ones. If you only sign up to TikTok just to watch ours, it will be worth it. So, but she also, anyone on Instagram? Is anyone more? Oh, there's a bit more. So are you all following our Instagram page? Yep, excellent, that'll do. Thank you, Spike. Not be singly. But it's definitely worth following. And then we also have our serious page, our serious messages when we're on LinkedIn, and also on Twitter. You'll see us tweet regularly. So it's worth following us and also letting your friends and family know that these channels are available, because there is some informative stuff on there. It's got to be a better word than stuff, but in terms of, the messages that anyone with lungs can get lung cancer, what are the signs and symptoms, so that, we're hopefully catching anybody slightly earlier as well. And these are some of the successes that Laura has had. As you can see, our Instagram impressions have gone up 71% since Laura came on board. So she seems to be quite good. And our TikTok views, I think one of our TikTok videos had 14,000 views. Which is quite phenomenal, really. They haven't all had that, but that's good. And our Twitter followers and LinkedIn, we're steadily increasing, but we need to keep going. Earlier this year, we were awarded a PIFTIC award, and we are really, really proud of that. So we're the first and only, if you like, lung cancer charity in the UK to have a PIFTIC accreditation. Now, what does that mean? In our stakeholders' eyes, in clinicians' eyes, and other charities' eyes, what it means is we have proper procedures for collating information, and it's informative and it's correct, and you can trust the information that we give out. That's what the PIFTIC accreditation gives us. So it's a trusted form of information. So if any of your healthcare professionals say, oh God, you're not on one of those online support groups, are you? You can now say, oh, hang on a minute, this is accredited. Yeah, we've got a lot of work to do now. So that was kind of the easy bit, although Graham at the back of the room wouldn't agree it was easy to get it. But now we've got to make sure that we've got systems and training and everything in place so that we can follow the procedure going forward with all our other publications. Okay. And we've had some appointments. So we've appointed a professional treasurer. Sean Hill, he is one of our trustees, and he's taking on full treasury duties by the end of the year. So Sean, are you in the room? I thought you were, yes. Yeah, lovely. So that's Sean. So all things finance go to him. And of course, we have appointed our first CEO. So, and his task really is to ensure that the charity is fit for purpose and sustainable. So if you want to know what Duncan's going to be doing, he's over there. You can catch him before you leave. All right. So this is what we look like as an organisation. It's not bad. Where we've got to over the last 5 years. So we have clinical advisors, regional ambassadors. You can see it for yourself. So we're in a good place. And now what we will be having is a strategic event in November, where we will be planning for the next 5 years, because what we need to now do is really look at where are we taking ourselves for the next 5 years. And that's part of the survey that's coming out so that we can understand what you... it was, yeah. Yeah. To understand what you guys want us to deliver in the next 5 years. Okay. There is a trustees report on the website if you want to read it. You weren't going to see any of that anyway. So as I say, we've got a planning meeting 24th, 25th of November. And these are the people that will be taking part, but we will be sending out a questionnaire to broader members to get some information beforehand. And then on 2nd of December, we will all celebrate at our regional get-togethers. And the last thing is just for me to say thank you. We wouldn't exist without you. And certainly the Facebook group would be dead without you guys. So I can't thank you enough, because it's you that brings this charity to life. I hope you've had a great conference. We've still got more to come. We've got a great speaker now. But I just want to say a personal thank you as well, because it's you guys that give me the pleasure in doing all this. So thank you very much indeed.